Hi, my name is Mahima. Welcome to my life. Today I'm going to talk about healthcare consulting. But before that, let me introduce myself. I am Mahima. I have close to 12 years of experience, primarily working on consulting and IT health engagements. I'm currently working as a manager in healthcare consulting in Accenture. Prior to that, I was with HCL Technology for 8 years. I work across different geographies like India, US, UK, Singapore. Played a number of roles like domain consultant, program manager, project lead. Talking about my education, I am a BSc Botany Honours from Delhi University. Post that, I have done my MBA in marketing from Amity. Consulting is nothing but providing consulting services to healthcare providers or payers. When I say providers, I mean hospitals. Payers means insurance companies, clearing houses. So we provide consulting service to these organizations. This is hospital management. In hospital management, you can learn a lot about what are the different processes which are involved in a hospital, how a hospital is managed, what are different departments that are there that you can gain easily from the subjects that we read. Time management. So whenever anybody is part of the health consulting engagement, it's time bound. You have to make sure that the deliverables or the milestones that you have to achieve, they have to be achieved within a certain set time, and hence time management plays a very important role. Not only in terms of abiding by a particular project plan, but also in doing your day-to-day activities or project work. You have to make sure that when you are in a proper consulting engagement, it has to be governed by proper time management. Next is in consulting, you work across different geographies. You work across, I have exposure working in India geography, US, UK, Singapore. And you tend to meet, people of different diverse cultures, and you learn to, interact with them, and how one community is different than the other, and how they contribute towards your positive growth, which is key to this consulting career. Other than the challenge that I talked about, extended working hours, other challenges involve at times, again, this can be considered as both positive and as a challenge. Consulting involves a lot of travel. And at times you have to travel to different places at a time when you don't want to travel. Hence, traveling is a challenge which is considered as a challenge by many of the individuals. Also, starts at 7 in the morning. Start with a cup of tea. Drop my child to the school, and check starts with by checking my mails. Looking at what's pending from yesterday, and typically, mornings and evenings are heavy in terms of calls because, I normally work with clients from US geography. So I have a lot of calls which are planned early in the morning or late in the evening. So it starts with calls followed by, interacting with my team at offshore. I'm managing multiple projects today where I have to deal with multiple delivery teams as a healthcare manager. And therefore, most of the day goes into coordinating and managing the milestones and the upcoming deliveries. Typically, day ends by having calls with the clients and the internal consulting teams across India and US. And that's how I close my day, at around 10, 10:30, 11, based on the flexibility, based upon the extended timeline that is required for the day. I hope I've been able to give you a balanced view on healthcare consulting. Thank you.